I'm Dr. Sane. How may I help you?
It's paining. There's a lot of pain in my tummy. I cannot bear it. I'm also bleeding.
Abdomen soft, rigid, and tender. Get serum HCG, progesterone, and vaginal ultrasound ASAP. Immediately. On its way, sir. She's pregnant, high HCG, progesterone, and also on ultrasound we found that she has ruptured her fallopian tubes. Ruptured ectopic pregnancy. Take her consent and prep her for surgery ASAP. We have got your test and we found that you have a pregnancy of 7 weeks outside your uterus within your tubes, and to save you we need to do self-injostomy through laparoscopy. Her surgery was performed successfully and now she is in the post-op room. Now talking a bit about the ectopic pregnancy, it is the implantation of the fertilized ovum at the site other than the uterine cavity. The sites of the ectopic pregnancy include the fallopian tube being the most commonest. The other one include the ovary, abdominal pregnancy, cervix, and also the vagina. The predisposing factors include any pathology that distorts the lumen of the fallopian tube, blocking the path of the ovum to travel from the ovary to the uterus. Similarly, if the patient has undergone sterilization procedure, the ovum won't be able to enter the uterus. Or if she has undergone a tubal reconstruction, the tubal disease, which is also known as the salpingitis ischemica nodosa, also leads to the same problem. If the patient is having an intrauterine contraceptive device, the ectopic pregnancy can also occur. If the patient was exposed to a diethylstilbestol during her intrauterine life, the ectopic pregnancy would occur. Similarly, the assisted reproductive techniques like IVF, GIFT, ZIFT would also lead to the same issue. The patient mainly presents with the acute presentation of the acute abdomen hypovolemic shock, or as our case, it was the subacute presentation in which the patient was presenting with the pervaginal bleed along with the severe abdominal pain, the pain which was coming directly because of the rupturing of the ectopic tube. The investigation include the serum HCG, progesterone, mainly to confirm the pregnancy, and to check for any of the ruptured pregnancy. The blood would be seen in the transvaginal ultrasound. For this purpose, colpotomy can also be done. To diagnose the abdominal pregnancy, the laparoscopy have to be done. As the pregnancy occurs in a non-natural place, mainly in the fallopian tube, so the tube forces to expel the pregnancy in the uterus, where it may either be aborted or be continued as the normal pregnancy, or it may also be expelled in the abdomen to be continued as the abdominal pregnancy. Within the tube, it may also get absorbed to form a tubal mole, or it may spontaneously regress, or it may progress to eventually end up the pregnancy by rupturing the fallopian tube. The treatment involves a medical and a surgical one. The surgical one further has two types, the laparotomy or the laparoscopy. It totally depends the condition on which it has to be done. The laparoscopy is mainly done when the ectopic pregnancy is less than 6 cm and the beta HCG level of less than 6,000 international units. As our patient was hemodynamically stable and the massive hemorrhage has not yet taken place, so we did laparoscopy for this. Medical treatment is done in unruptured tubal pregnancy of less than 4 cm with no hemoperitoneum and a beta HCG of less than 3000 international units. In this case, methotrexate is given. Laparotomy is done when the laparoscopy is contraindicated or the tube has been ruptured and the patient is hemodynamically unstable. In such condition, we can either do salpingectomy or a tubal repair. The tubal repair further has further types, including the partial salpingectomy, also known as the end-to-end anastomosis, in which the ischemic portion of the fallopian tube has the pregnancy. Salpingostomy is done when the other tube is absent or damaged, or it is the cause of the recurrent pregnancy. In this case, a longitudinal incision is given over the pregnancy and the pregnancy is removed and then the tube is sutured. If the pregnancy is implanted in the femoral end, then the fallopian tube is milked to remove the pregnancy. This was all about the ectopic pregnancy. Hope you get it well.